Okay, we're going to begin because we've got a lot to cover. First of all, I want to thank Armed's Pharmacy, Yechiel Reis and family for sponsoring. B'schus Refuah Shlema for Aaron Ali Melech, Ben Brian Leah, and Bluma Bas Masha, and Yehudis Bas Fega, and that they should have a B'schus Refuah Shlema, and an Elias Neshama for Mirol Bas Levi Yosef Allah Hashalom, and Sarah Gittel Bas Dov Allah Hashalom. May the Neshamas have an Aliyah. So first, a few disclaimers, then we can get started. If you haven't noticed up until now, I am not a doctor, so I am not going to be giving medical advice. I'm also not the Morad Atra, so I'm the assistant rabbi, so I can say that everyone should ask their local senior rabbi for halachic guidance. So that way we can just do away with anything Lamaisa. But Rabbi Kropkin is out of town, so maybe if you have a pressing shaila, I can answer the question. But we're not going to get into such controversial ground, so we're going to raise some questions, but I think you're going to be informed and be a more educated questioner, which is what my goal is, to understand some of the parameters of what the questions one should be asking in terms of taking medications on Shabbos. I'm not really going to get into the discussion between versus Shabbos Yontif and Yontif Sheni, although there are distinctions in the poskim, but I'm just going to focus on Shabbos. There's also a large variety of different medications. I'm going to discuss one particular medication, which I also really don't know how it works exactly. So, but I think many people are familiar with this, and it will be sort of an example, and you can maybe draw some parallels, and we have some very informed pharmaceutical and medical professionals here, so maybe they can help also clarify some issues. So there's really going to be two parts to our topic for tonight. Our topic is taking medications on Shabbos, but I'd like to do two parts. The first part of the discussion is really going to be sort of an introduction, and it's a question that I've often wondered. Maybe you've wondered it also when you enter into the topic of taking medications on Shabbos, which, by the way, another disclaimer, Rabbi Dr. Lesher Friedman gave a class about 2 years ago on this topic, so I'm going to try to steer away from his basic, very important primer on this topic, but if I'm going to try to maybe make sure that we cover some new ground for those who are still holding by this year, even though it was 2 years ago. But in general, I'm going to assume a very significant amount of knowledge, and if you have questions, please feel free to ask, because it's an in-depth topic, and I think a lot of people are somewhat familiar with this general discussion. So I'm going to assume a large amount of knowledge. I'm going to translate. I'm going to try to explain, but if I'm going too quickly, please feel free to ask questions. So it's a question the first part is a question I've often wondered when entering this topic, which is, why do we still have a prohibition against taking medication on Shabbos? There's a prohibition. The general understanding is it's rabbinic because we're worried that someone who's desperately ill is going to violate the prohibition of tochein, of crushing, because of something called shchikas samimonim. You're going to take the immortal and the pestle, and you're going to crush different types of things to make a medication on Shabbos, and therefore it is prohibited. Now, anyone here as an individual make medications for themselves? No one does. Or you do, okay, but not for yourself. Not for yourself. But most people, they go to our meds, or other lesser well-known ways to get medications. But they go to our meds, and they have the pharmacist make their medication for them. So why do we still have this prohibition today at all? That's kind of the first topic I'd like to address, which with whatever time we have left, we're going to discuss part two, which is taking Ritalin for ADHD on Shabbos, which again, it's basically, it treats hyperactive activity. It's actually a stimulant, but without getting into all the details, it is, I would say it's not in a physical ailment in the same way that, let's say, someone who has other types of physical pain, or as we'll see, no filamishka, someone who's lying down, someone who is in a different way struggling with staying still or paying attention, does take medication, or with doctors' approval, is often prescribed ADHD. Children and adults are prescribed Ritalin. So I'd like to discuss the permissibility or the possible arguments to permit. I'm showing all my cards. The possibility, the argument to permit taking Ritalin on Shabbos. So that's part number 2. So part number 1, I'd like to begin with a piece. It's in source number 1, a piece by Rav Avraham Chaim Noah in his Sefer Ketzos HaShulchan. Rav Chaim Noah is very well known in one area of halacha, which is his area of shiurim, is the amount of different things you have to eat or fulfill. Is often quoted in Hilchos Pesach. But he was actually a very well-known 20th century posek living in Eretz Yisrael, and he has a very important sefer, Ketzos HaShulchan, which is often overlooked in the halachic literature. And I would like to do pretty much all of this piece, because it's, I would say, one of the most thorough pieces that I've seen in the literature about this question that we asked, which is, why do we still have a gzeira? Why do we still have a rabbinic decree prohibiting the usage of medicine, because we're worried you're going to crush things when nobody's crushing anything? V'nira lomar de'isa refuah mishum gzera shrika samamanim kil tfei bezmanenu. Rav Chaim Noah tells you straight out of the gate. I think it is more lenient in our generation, our times, the prohibition of taking medicine because of the concern of crushing different types of medicinal products to create medicine. Sha'ach shav, because now ein bikiyin b'shrika samamanim or samanim. We are not experts in how to practice this crushing of the medicines. I think I'm pronouncing that correctly. Anyone know how to pronounce pharmacy? Mirkachat? Mirkachat is a pharmacy. And you go and you get your medicine from the pharmacist. Kudas harofe, and you get the exact prescription from your doctor. Lo shayach lemigzar dilma asi l'shchikas hamanim. There should be no reason. It's not relevant to prohibit the taking of medication because of this concern. And he says it's very similar to a heter, which I know that Rabbi Karapkin told me when he first came to Toronto. He gave a number of shiurim that set off some controversy. I said, what is it? He said, about clapping on Shabbos. I said, that was controversial. So one of the shiurim, if I remember them throughout this year, I'll let you know what it was. One of them was clapping on Shabbos. The other, showering on Yontiv. He told me we created a whole splash. Other things, I don't know. But he said, remember the third? I wasn't here, so. Singing Kel Adon, okay. Wow, really? Going far out there. But in all seriousness... pausing. Not pausing. No, but there was another one. I don't remember what it was. Either way, it'll come to us. So, Rabbi Karapkin told me that when he came, he gave a shiur. Basically, you could probably find it somewhere in the archives in Lesher Friedman's notes. There's no prohibition of clapping on Shabbos at all. And this is based on a Tosfos, which we'll see together. And he quotes this, it's a Tosfos in Beitza, which is quoted in the Ramah, which is basically the reason why we don't clap or we don't dance on Shabbos, is that the reason that originally it's a Mishnah in Beitza, which says that you're not allowed to clap on Shabbos, and the reason it gives is because you're going to come to, anyone? Fix a musical instrument. Now, I happen to play guitar, and I still don't know how to restring my own guitar, but there are people that know how to restring their instruments, but it's not a very common, widespread activity that is known, but apparently, if you dance, and you possibly play musical instruments, then you would come to, if the instrument breaks, you would come to fix it. And Tosfos says, maybe just skipping a little bit ahead into the source sheet, in source number 3, commenting on the Gemara in Beitza, Daf Lamed on the base, source number 2. Ein metapchin ve'ein meraktin. We don't clap, we don't dance. Pirish Rashi, Shema yitakin klishir. Because maybe you're going to come to repair a musical instrument. Umiyuli didan, but according to us, Shari, it is permitted. In other words, to dance or to clap on Shabbos. The davka be yemeyim shari bekiyin lasos klishir. Since in those, it was only for that time specifically where they knew they were experts in how to making musical instruments. However, avalididon ein anu bekiyin. We are no longer experts. Lasos klishir v'lo shayach lemigzar, and therefore there's no prohibition. And it is quoted as well in source number 4 in the gloss of the Ramah in Shulchan Aruch Orachaim Shin Lamites Siv Gimel as a yesh omrim that we do not have a prohibition of clapping on Shabbos. Now, there are those that disagree with this, as we'll see. But the Rav Chaim Na says it should be similar to this idea that we no longer have a gezerah against clapping because of the fact that it's not a relevant and widespread skill to be able to repair a musical instrument. Okay, I'm just going to skip a little bit ahead. So he wants to basically say that the Isser, the prohibition, even though it was a rabbinic enactment, but it falls away because the reason for the prohibition originally is not relevant any longer. Okay, now he says, okay, there are those that disagree with this, fine, in the parentheses. Mikol makom yesh lefakfik b'zeh. But he says, I'm not 100% sure about this, because, first of all, even though even though we're not experts, you could say there are places in the world meaning I guess homemade medications. There are places in the world that maybe they make their own medicines. I'm not sure what they do in other countries, but I'm thinking of less civilized countries. Maybe they're making their own stuff at home, or maybe indigenous populations. I don't know what they do, but they still have, back in source number 1, they still have this practice of their forefathers, so to speak, that they're still doing it. Maybe we could say that since the reasoning is not completely lost upon the world, in other words, some people do make their own medicines, so therefore maybe the Gzeira still stands in its place. I think homeopathic remedies or some alternative medicines or other types of things, maybe you could argue they're not medicine, but people are involved in the creations of some sorts of herbal treatments, and therefore either by choice or by lack of sophistication, they are still making their own medicines. So maybe you can't really argue it's not relevant anymore. Maybe it's more still relevant. Okay, and then he goes into a discussion, quoting a sefer from it's called the Torah's. The Torah's not Chatas, but it's the. Sorry, one second. He quotes from the Gaon of Lublin. I'm for whatever reason not seeing it. One second. Torah's Chesed. Thank you, Lesher. He quotes from the Torah's Chesed from the Gaon of Lublin that he writes that he compares this to another big topic, which is there such a thing as Rishus Harambim Bizman Hazeh? Do we have the concept of a public thoroughway, the way that the Talmud defines it in our times? And one of the reasons that we allow for Eruvin is that we put into the into the discussion the position that no, Ein Rishus Harabim Bizman Hazeh, which means it's impossible to satisfy all the definitions of Rishus Harabim. 600,000 people. It has to be a certain depth and width. It's not very relevant to have any longer. And he says maybe that we should compare it to that. So he says the concerns and the rabbinic enactments, even though we don't have Rishus Harabim Bizman Hazeh, but sometimes it could be possibly relevant, and therefore nimsa b'makom ba'olam shisham Rishus Harabim. Even though it says ein Rishus Harabim Bizman Hazeh, there is no such thing, but there are some scenarios where you could find something like that, and therefore there is still concern at the rabbinic level, without getting into the details of hotzah, of carrying into an area of Rishus Harabim. He says, but that's different. He wants to argue in the name of the Torah's Chesed, the Gaon from Lublin, that maybe shchikas samanim is even more lenient because he says it's slowly becoming irrelevant and you won't be able to find in most places anyone doing that. Okay. But at the end of the day, he retracts. Yeah, so I did skip a lot of the discussion here, but I think at the end of the day, that's his major raya, his major proof from clapping on Shabbos. And then he just basically says, I don't want to argue exactly that it's completely gone because some people do create their own medicines, and therefore, at the end of the day, he says, what I'm willing to say is it's more lenient. V'yesh lasos sniff misfarazu. What we can do is we can use this as a sniff lahakel. A sniff lahakel is that basically if you have other factors, other mitigating factors to permit something, we can throw this in to even make it more lenient. So that's what he wants to say at the end of the day. Since there are others that disagree with the Gaon mi Vilna, the Gaon mi Lublin, and he's not 100% sure that the relevant concerns of making medication, like we mentioned, is completely null and void. Is it really totally lost to the world? He's not 100% sure, but therefore he wants to say that we can use it as a sniff lahakel. Then he says something very interesting. There are people who are very, very in doubt. They're always wondering in relation to this particular shaila. They have a lot. They're in a lot of pain, and even though they are in a lot of pain, they can't make a decision. If their whole body is weakened, mizeh, from the sickness, or maybe they're not so sick. In other words, when they ask a shaila, this is part of the question that I believe Lesher discussed a number of years ago, that if you're nofel mishkav, if you're bedridden, or if your entire body is weakened by a sickness, then you are allowed to take medication. The Gezerah D'Rabbanan doesn't apply. But there are people that they never know. Is this enough sick? Is it enough? They're indecisive, and they're in pain. So the Rav Chaim Na is arguing that, Yichol nismoch lahet refuah b'zman hazeh. We could tell these people, you don't really know if this qualifies as enough of a reason. Don't worry about it. You have this svara of it's not relevant any longer, anymore. Anyways, so it's not so shayach chokach hashash chigas hamanim, and therefore you can go ahead and take the medication. But if it's just a small little pain or ache, the lukuli alma asur b'refuah ein lahater gam b'zman hazeh. So the real nafkamina, the real takeaway from this Rav Chaim Na is pretty much. I mean, he's arguing pretty strongly. Anything that's a little bit above a mechush ba'alma, anything that's a little bit above a slight ache or pain, he wants to argue is, if you're not sure that it reached the threshold of being bedridden, he says, you know what, you could take the medication because, as we mentioned before, if you're on the borderline, if you're not sure, we have this allowance of this concept that the concern for shchikas samanim is not relevant any longer today. Now, as you can imagine, not everyone agrees with this. There's a sefer written by Rav Hershel Shechter, Nefesh Harav, where he quotes Rav Soloveitchik as being extremely upset when he heard of a modern sefer. I don't believe he's referring to Rav Chaim Na, but it could be. But he heard of a modern sefer that came out that he praised himself in this sefer for coming out and saying you're allowed to take all medications on Shabbos because it's not relevant any longer, this concern of shchikas samanim. And he says here in source number 5, I remember how upset our rabbi was, Rabbi Soloveitchik, our teacher, al heter la bal abayis shelo likach trufos b'Shabbos v'yontif v'amer b'zel lashon, and he said like this: al rishonim anu mitztarim, we're in pain on the rishonim. What does that mean? Klomar she'en anu mivinim al nachum kavanas hatoisves b'ma she'tiru l'tapeach u'leraki. We don't understand. In other words, remember the reason that Rav Chaim Na gave, and I guess presumably this other sefer, if it's a different sefer, in fact, is that we don't have a prohibition of clapping anymore because of the Tosfos, because we don't know how to make musical instruments, and therefore we'll apply that to medications. So Rav Soloveitchik heard about this, and he said, what are you talking about? You think Tosfos makes any sense? We don't understand Tosfos, which implies that we aren't going to follow that leniency, which I know that others also don't want to follow that leniency about clapping and dancing. In other words, Rav Soloveitchik is saying you're making a whole leniency based upon something which we don't even understand to begin with, because the implication is that, I don't know, like they were more expert in making musical instruments, we are less. Like it's a very strange, what are the facts over there? And really, are we going to go so far as to say that the gezerah is no longer? It seems to be that Rav Soloveitchik questioned the very basis of the allowance. Other poskim are along the same lines of Rav Chaim Nar, Rav Ovadia, Rav Elazar Melamed. You can take a look. I have some resources for you, some research materials that I have, a number of articles. I believe Rabbi Gil Student has a nice list of the lenient positions on this. However, we have Rav Soloveitchik, Rav Moshe Feinstein, and others that are stringent and assume, and this is I would say the mainstream assumption in the poskim is that today is the same as it was in the times of the Rishonim that discussed this, and therefore we keep this prohibition. I mean, it's also discussed in the Gemara, but we keep this prohibition where it is, and you can see this from source number 6, Rav Moshe Igros Moshe or Chaim Chelik Gimel Siman Nun Gimel. He was asked a question about taking medications when one person has two ailments. One is he's a chola she'im bo sakana. He's someone who is not in danger but is allowed to take medication. Can he also, once he's taking that medication, could he also take a different medication which would not qualify on its own? And you can see that in the course of answering this question, Rav Moshe assumes that there is a concern of shchika samanim, and he throws in a few other things interestingly also. It's not 100% clear to me if this is what he's addressing, but I saw that some of the later contemporary writers say that one of the reasons that are given for why we still have the prohibition today is because there are other concerns that we have about medications. It's not just about crushing medications, and they quote this Rav Moshe, but I looked at this Rav Moshe, and he just sort of says it as an aside, which is, he's not addressing our question point blank, but he does say that yesh lachush l'shchika samamanim v'habishol v'ha'otzal l'rishos harabim. Wow. Okay. I don't know of any earlier source, but Rav Moshe is saying that you're not allowed to take medication on Shabbos is not just because of the concern that you're so desperate you're going to crush medications. It's also, we're worried maybe you're going to start cooking something to boil up some water, maybe for mixing some medications or something. Yichil, do you ever have to boil water for or cook anything or? Not usually, no. But maybe you'd have to purify water. I don't know. Maybe if they had dirty water or something. I don't know.
You distill water.
Maybe distill water. Okay, so maybe you'd have to make this. But Rav Moshe is saying there are other malachos that may be concerned, and therefore you can't say it's not relevant. And obviously, maybe you need a specific type of medication. You're going to go out into the street and carry Rosh Hashanah.
Ask a question.
Yes.
Just the term refuah implies healing.
Yeah.
Right?
Mm-hmm.
But I think that, is it possible they're using it in a broader sense to include other things that people thought were healthy, mixing herbs and all this other stuff that's not necessarily healing an illness? Refuah implies healing an illness, right?
Correct.
Illness is a chola.
Yeah.
Which may be exempt from these restrictions.
So
my question is, maybe we're not understanding the term refuah the way it was meant to be.
Well, the way that they made medications in more ancient times and even medieval times is they would crush the different,
but
ingredients.
For the purpose of healing,
yes.
Then you're dealing with sickness.
Yes.
Right? We're talking about there's not necessarily a chola. Can you make medications for?
We're going to get to that. We're going to get to if you're not sick. Vitamins is a different case. Vitamins is a good example. We're not addressing vitamins point blank, but I'll just tell you it is a debate between, I think, Rav Moshe and Shlomo Zalman. I have to check my notes, but I believe one of them holds that vitamins are allowed because they're more like food, which is allowed. You're allowed to eat food that makes you stronger, even though it's helping the body. It's Michael Briam. Healthy people take vitamins, and other opposing I look at it and say, no, that's like medication, and therefore you're not allowed to take it. But in general, we're going to get into the question of is a person sick or is a person healthy when we deal with Ritalin as an example. But right now we're just dealing with what was the reason that the rabbis initially came along and said you can't take medicine. you're sick, but it's not life-threatening. You're not bedridden, because we're going to see bedridden, you're allowed to take the medication. But you are, let's say, you have allergies, and you're coughing away, and it's uncomfortable. You're not bedridden, it's just uncomfortable. Am I allowed to take allergy medicine? So, according to what we were discussing, Rav Chaim Na was suggesting, just to go through a little bit of a review, and then we'll move on to the next one, but just to clarify what we said, Rav Chaim Na was saying, there's no problem with taking medicine. What's the problem? Oh, you're worried you're going to be so desperate, you're going to crush, to make reactin, you're going to, I don't know what you make, you make react. Oh, you're going to crush the medicine? Nobody crushes medicine anymore, so it's irrelevant. He kind of pulled it back and said, well, there are some people that maybe still make medicine themselves, real medicine, not like herbs, but real medicine. So maybe it's still in play, but like very, he wants to be very lenient when it comes to that. And other poskim say, no, there's no difference between nowadays and previous generations. It's the same stringencies and the same leniencies, which we're going to start to see in a moment. So that's sort of the general debate. Yes? Very good question. Okay, I think that was going to be my third part, but I didn't figure we'd have no time for it, but I'll just jump to the end. Yeah. So let's say you're allowed to take the medicine. For whatever reason, a person is allowed to take it. We're going to assume that they're allowed to take it, but they can't actually ingest it. They want to crush it on Shabbos. So this is something that I recently discovered. It's an explicit line in the Shmir Shabbos Kilchasa, in source number 29, Perek Lamed Gimel, and the Shmir Shabbos writes, Mutter leforer glula ulamisa betoch mayim. It doesn't even need to be in water, but you're allowed to crush a pill. And why are you allowed to crush a pill? Didn't we just say we're worried about a person crushing things together to make their medicine? No. This was already crushed. Look at footnote Lamed Zion. Ein tchina achar tchina. Once you made, you can have tchina twice. It's okay. I'm not sure how it became tahini, but out there in the world, tchina became tahini. There's hummus became hummus, and tchina became tahini. I don't know. Don't ask me why. But either way, tchina is the tochen, is the melacha. So you crush however they crushed it in the factory, however they made it, and they put it into a nice tablet. When you then want to crush it, and the poskim say you could even do it on the line, you could even cut it with a knife, you could do whatever you want to it. On Shabbos, I'm talking about. How could that be? Rabbi, didn't you just tell me we're worried about crushing? No, it was already, this medicine was already made. It was already processed, and therefore there's no problem with crushing the medication. Counterintuitively, right? Because the whole reason is you're not allowed to take medicine because we're worried that you're going to make medicine, because let's say you don't have any and you have all these herbs in your house or whatever. So you're going to make the medicine fresh. That's the concern. That's the concern. To understand why I was bothered by that, now you now have a better appreciation. Nobody has herbs in their cupboard that they have to make fresh into medicine, right? They have medicine. Medicine you can crush. There's no problem with crushing medicine, because that was already manufactured. Clear? So therefore, some of the poskim said it's very, very likely that there's no relevance to this gezerah. Rav Chaim Na sort of pulled it back a little bit, but was making this argument. And Rav Moshe and the Mishnah Berurah, Rav Shlomo Zalman, most of the mainstream poskim, I don't want to say Rav Chaim Na wasn't mainstream. He was definitely mainstream, but I would say the majority of the poskim, the consensus seems to be that we, Rav Soloveitchik also, that we do whatever the regular parameters are, which we'll discuss now as an example with Ritalin, but the regular parameters are still in play in today's world. But you may have more leniencies. I think that's Tzitz Eliezer and others. But Rav Chaim Na is, I think, the place where he sort of is one of the most explicit and, cogent arguments that he makes there. Okay. I have part number 2 as I sort of titled it non-medical medications, but I'm not sure that's a good term. Yechiel, what would be a good term for, we could throw in birth control into this discussion, Ritalin. It's not curing an illness. It's right. It's not making, if the body is experiencing some sort of pain, that's one type of medicine. But this is like, it's treating something, but it's manipulating the body, but it's not. it's controlling it. How would you? What would be? Is there a term for non? It's not an illness.
It's not a life-saving medication.
It doesn't take
Not
away your
life-saving?
diabetes.
It's not life-saving, right? Treatment. It's a sort of treatment, right? Okay, so maybe we'll develop the term as we continue.
Well, I guess it's not for treating a disease state.
Right, it's not a disease in the same way. ADHD is a diagnosis, but it's not I don't know. Maybe people would say it is a disease. It's a mental illness. I don't know.
Maybe it's balancing. It's balancing your own, hormones or chemicals. Or
Right, hormonal treatments.
like
Right,
that. It's,
right.
supplementing or suppressing.
Right, helping the body function in its normal manner. So, I'm using sickness versus disease. Symptoms. Okay, symptoms versus disease. That's good. Sleep medications, another good example. Yeah, allergies, insulin, maybe. So I'm using Ritalin as an example. One of the reasons is that I heard a shir by Rabbi Aryeh Leibowitz, who was quoting from a tshuva written by Rabbi Rubin, who's the author of Orchos Shabbos. Unfortunately, I don't have access to the tshuva, but I have a lot of the source material from this tshuva. And he wants to make, I believe I counted 9 arguments, or maybe even 8, but I'm adding on more arguments to allow for the taking of Ritalin on Shabbos. So let's start with a general heter, which applies to other types of medication. It's probably not going to apply to Ritalin, but just important for us to know. The Shulchan Aruch writes in Or Chaim, Siman Shin Chaf Ches Sif Lamed Zayin. Well, actually, I mentioned this before. This is a gloss of the Rambam. I'm just going to go to the last part of the Shulchan Aruch. Im nafal lemishkav shari. That's not enough of a line. Let's go a little bit further back. You know what? We'll just read from the beginning. Sorry. Kol ochlum mashkim sheim machal b'riyim mutter la'ochlum l'shtosim l'refuah. Afal pi shehem kashim l'ktsas b'riyim. This is source number 7. Anyone who's eating or drinking food which is eaten by regular, normal, healthy people, but they're doing it for the purposes of healing. In other words, a person's sick, they have a fever, they have a virus. The doctor said to drink water, so that's helping them get better. How are they allowed to do that? Don't we have a problem of refuah, of healing? No, obviously that's not a problem because it's his example is it's even not so. It's not so appealing to the healthy people, so that wouldn't be water. But let's just say something which is not appealing to healthy people, but they do it, they do drink it or eat it. That would be allowed, even though even though it's clear that he's doing it for medicinal purposes. Afilu hachishari. But then he says anything that's not that way. In other words, healthy people don't eat or drink or take something that he's doing and he's engaging in that. Mi sheyeshlo mechush ba'alma. It just has some sort of ache or pain. V'u mischazik v'holech kebari. That he could sort of function normally. Avol im ein lo shum mechush mutter. So it's a little bit counterintuitive. If the person is completely healthy, can a healthy person take medicine on Shabbos? Seemingly yes. If he is a little bit sick or has a little bit of an ache, no. Then he writes, and the Ramah writes, v'chein im nafal mishkav shari. If a person is bedridden, then it is permitted to take. So we sort of have a number of different categories. I don't remember all the Roshei Tevos that Lesher had for his presentation, but there's different categories. But the category of being nofel mishkav, the way Rav Shechter explained it to me once, is it has to be impacting your normative functioning. It doesn't have to be literally you're lying in bed. I remember I asked him a shaila once. My wife had an ingrown toenail, so I asked him, can she put some Vaseline on it? Healthy people don't put Vaseline on. He says, yeah. How's she doing? And I said it's really impacting her. She can't really walk around. She's in a lot of pain. He's like, sure. She wasn't lying in bed. She was but it's impacting your normative functioning.
But isn't that anointing, which is forbidden?
So she didn't rub it in. She just sort of put it on, maybe with I don't remember the details. Maybe I asked him if she can clip the nail. Maybe that's what I asked him. I was just, as an example of, without other malachos involved, I believe that he was saying that if it impacts your normative functioning, he included that in the definition of if it's nofal lemishkav, even though you're not literally bedridden, but it is affecting your normative functioning. So that obviously is not going to be relevant for Ritalin because although it is affecting your normative functioning, however, you're not in pain, you're not, you may have certain symptoms like Lesher said, but it's not presenting in a painful or diseased type of way. What about a different kind of heter? The heter which is well known to many. It seems to be well known to many, but unclear exactly what the source for this is, and that is a regiment over a number of days. One of the earliest sources for this is actually Rav Shlomo Kluger, and I found this quoted in a shuva of the Tzitz Eliezer of Eliezer Waldenberg, and he quotes from Rav Shlomo Kluger in his Sefer HaChaim, this is source number 9, Margala bepuma de inche. It's sort of found upon people's mouths. In other words, it's commonly stated, if you started a regiment of medications before Shabbos, you're allowed to continue doing it on Shabbos. But if you didn't start during the week, you should not start the regiment on Shabbos. But however, we don't know really what the reason that people say this. And he goes into a whole discussion of where this source comes from. One of the sources that he marshals as a proof for this is a Gemara in Shabbos. The Gemara in Shabbos says that if you took some sort of treatment on Chamishi and then Shishi, you can look at source number 10. You took some sort of, it's called asophatia. I'm not sure exactly what that is at all, but some sort of drink, and you did it on Thursday, then you did it on Friday, and the Gemara says you're allowed to do it as well on Shabbos. And the Rambam understands this to be, if you look at source number 11, actually source number 12, sorry. Source number 12, the Rambam says, Shasa Chiltis, he says it's a Chiltis, which I also don't exactly know what it is, but it's some sort of treatment. Mikodam HaShabbos v'harei u'shotz v'holech mutar l'shotz b'Shabbos. Once you started drinking this Chiltis, you can continue. Afilu b'makom shelo nogo abriim l'shotz ha'chiltis, even though healthy people in that place don't drink it, and you're allowed to do it as well on Shabbos. That's one of the sources for the heter of a regiment of medications. However, other poskim question this. Rav Shlomo Zalman is quoted in Shmir Shabbos Kelchasa as saying in Ha'ara, in Perek Lamed Zayin, Ha'ara Ayin Zayin, he says it's not such a good proof because the way the Rambam says it, if you look at a different Rambam, which I skipped over, the Rambam in source number 11, Shin Beis Zayin in Hilchos Shabbos, he says that you're allowed to continue taking this treatment or doing this treatment because if you stop, then you're going to be sick. If you don't take it, you're going to get sick. So Rav Shlomo Zalman says it's not a heter of sakana, but it is seemingly a heter of nofel lemishkav. In other words, back to our original discussion, why are you allowed to take a medication regimen? So people have this assumption, if you started it before Shabbos, you continue on Shabbos. Why is that? So Rav Shlomo Kluger said, well, we see that you're allowed to continue taking it in the Gemara in Shabbos, Daf Kuf Mem, and the way this chiltis or whatever this drink was, and the way the Rambam understood it is, the reason why you're allowed to continue is you're going to be sick if you don't take it. So if Shlomo Zalman says you can't just give a blanket heter to any medication that if you take it, let's say you're on a 10-day pack or a 7-day pack or something like that, or a 5-day, and you stop taking it on Shabbos, and then you continue the next day, you won't be sick, and that would be his concern. Rav Shlomo Zalman was only lenient for if you for sure are going to go through a Shabbos. Let's say it's an 8-day cycle, or 7 days, depending on what time, but you would for sure go through Shabbos. In that case, he says you're allowed to take the medication because obviously, by definition, you're going through a Shabbos.
Rabbi,
Yes.
as far I heard is that Zero Shlichus Sanamani is that if you don't have it and you're ill, you're going to come to Shlichus Sanamani.
Yes.
You have it.
Right.
So there's no more they can put
Interesting.
You haven't.
But you could make an argument for anything, though. We have the medication in our house.
Right, here, the patient is already
On it shows it's more of like a hecker or something like that.
It's not you're gonna get
Right.
He started it, he has it.
Interesting. Where? Who says that? You don't know.
I don't want to misquote.
Yeah. Okay. It's a nice svara.
Told us that, but I'm
Right.
I don't want to.
It's a nice svara. So just to say it a little louder, if anyone didn't hear it, maybe the heter is we discussed that we're worried you're going to be desperate and you're going to crush something, as a result of that desperation. But here, when the person starts the medication, they clearly show. By an action, they're showing they have the medication, therefore they're not going to be desperate, and they have it. So that's an interesting svara. It seems to be that Rav Moshe Feinstein rejects the very premise of this heter. In other words, the taking it as being on a pack or being on a regiment. He's only lenient if a person will be very distressed, and they have a 10-day cycle. You can take a look at source number 14. But he's much more stringent than others. However, I did find that in the Orchos Rabbeinu, Rabbi Bleich has a great article on this that he quotes from the interesting. It's like a sort of a modern sefer written about both the Chazon Ish and the Stipler. And in Orchos Rabbeinu, in source number 15, it says that the Chazon Ish was lenient even for a taking medication that was, let's say, 5-day pack, less than 7. Siper Li Hagon Rav Nassin. I believe this is Rav maybe it's Rav Nissin Karelitz. I don't know. Hagon Harav. Somebody, Shlita, a rabbi. Hora Shisham Maran Achazon Ish Zecher Tzaddik Livracha Kol Refuah Shetrichim Laks. Vikasa, Beritzifos Kamayamim, any medication that needs to be taken consecutively many days, even less than 7 days, Af Pachos Mizayin Yamim, Mutur Lahaskil Likasa, Miyad, Ulahamshech, I'm not sure if I'm pronouncing that right, Likasa, in the taking of it, Af B'Shabbat. Fa'atam dirak b'mechush ba'alma as refuah b'Shabbos mishum di'avor me'atzmo. Avol b'machala av she'ein bo sakana lo atzu lakachas trufos techazal lo atzu b'makom machala im tzarach lakachas trufos kamayamim im kein ein zeh mechush ba'alma rak begeder machala u'muter. I'll just translate this. What is he saying? I think this is a great svara. What was the reason that we said you're not allowed to take medicine if it's just a mechush ba'alma? If it's just a little ache and pain, that's that. But if you're really sick, if you're nofel mishkav, you're bedridden, or like Rav Schechter said, even if it's just impacting your general normative functioning, you're allowed to take medicine. If I'm on medication, this is the Chazon Ish Svara, maybe the doctors in the room will tell me if this makes sense in the medical realm, but the Chazon Ish is saying, if I'm on a pack, if I'm on a 5-day medication, this is not any mechush ba'alma anymore. This is a significant, ailment. Maybe it's not presenting in that manner, but he's saying it's not a mechush ba'alma. It's not just like a little ache. You're on a 5-day pack. This is serious business. And therefore, he said, not only can you just continue your pack, you could start it on Shabbos as well. And then he says he hears that the Stipler, who was also relied upon this psak of the Chazon Ish. So this is the most, people have this conception. Oh, in Bnei Brak, there's super machmir, and the Hasidim are super machmir. Yes, in certain things they are, but in other things, I have this sense, I have a chush, I can't prove it to you, but I think that the Hasidic poskim and in the Chazon Ish, they're very, when it comes to health, they're very concerned about making sure people are healthy. There's a famous Maisa, I can't verify it's true, but it's one of these stories that they say over in the yeshivas that Rav Chaim Brisker was once. This is Rav Chaim Soloveitchik, the great Rosh Yeshiva in first Volozhin, then Brisk, but he the Rav in Brisk. So he wanted to basically told his son Rav Moshe Soloveitchik that there was some sick person, and he told him turn it was on Shabbos, turn the light higher, like turn the light on a little bit better, so the doctors who were visiting them, that person could see better. And his son, Shabbos, and I guess we're talking about maybe like old style lights where you would have to increase the lamps. Would you have to increase the paraffin, the oil, or what's it called? Paraffin. And so his son hesitated and he didn't want to do it. And so he said, "Fine, I'll do it." And he turned it up himself. And people said, "How could you do this? It's Chil Shabbos. You're being so makel." He says, "No, I'm not being makel in Chil Shabbos. I'm being machmir in pikuach nefesh." So there's a sense that in the you could in certain areas of halacha that even those who are, you would think, so stringent are actually much more lenient because they are putting the person's health as a priority. I'm not going to be machriya between Rav Moshe and let's say the Chazon Ish. I'm just pointing out that there is on the books a heter to begin your medications even on Shabbos itself, as the Chazon Ish did. So that would be potentially a heter for Ritalin. Now you could say maybe not, because like we said, it's not really like what's it going. If you don't take it, if you're going to go, let's say, with the Rav Shlomo Zalman opinion, if you don't take it, you're not going to be sick. Would the Chazon Ish say it's not a mechush ba'alma? Again, I don't know. Maybe yes, maybe no. That's why I'm throwing in the more heterim that I throw in. So there's different things that can happen. Either you're going to be more convinced, or you're going to say, Lesher doesn't really have a real heter. That's why I have to say 7 or 8 of them. But here's another type of heter. There is an opinion of the Magen Avram. The Magen Avram says that if you're just taking something that is to strengthen yourself, this is in source number 16. It is his language is lahachzik. L'chazik mozgo, it's quoted in the Mishnah Berurah as l'chazik mizgo, to strengthen your body, that is prohibited. So that would be relevant to Gershon's question earlier about taking maybe vitamins or other supplements. So that's to the Magen Avram and quoted in the Mishnah Berurah in Shin Chaf Ches Kuf Chaf. The reason why I bring it up as a heter, not a prohibition, is that Rav Moshe Feinstein strongly questions this chumrah. He strongly questions this chumrah, and he quotes it in the context of vitamins. You can take a look, source number 18, Igros Moshe or Chaim Chilek Gimel Simin Nun Dalid, Be'inyan Ha Vitaminim, the vitamins. He says people want to know, healthy people take vitamins on Shabbos. Are you allowed to do this? And he writes that, well, there's this Magen Avram, and he says, the Magen Avram says you're not allowed to take things that are, even healthy people, but they're taking these things to lahachzik, or lachazek, their body, to strengthen their body. He says, maybe we should pass him like the Magen Avram because he's a later posik, an Achron, he calls him a Basra. He says, but this doesn't really make sense. We have to understand. The kevan duhu bari, Mashayich lomar shu l'rofe taha l'refua taha eno merape klum v'davar sheno marpe lika iser af im kavanos l'refua. If a person thinks this is making them better, but at the end of the day it's not refuah, so how can you say that it's considered refuah? It's similar to what Gershon was saying. And then he says even more than that, similar to maybe what Lesher was saying. What was our worry? Our worry was that he's going to go ahead and crush, in his desperation, crush, herbs and make pills. This person's not desperate. This person's fine. This person's healthy. They're just taking a supplement, so they're not going to be pressed to violate the halacha. So he's not really so convinced. He leaves it a little bit like, questionable if we have to be machmir for this concern. Placebo is not a medication.
I know, but in your mind, it is a medication for
you. You don't know. Interesting. That's what he's trying. According to this Reb Moshe, it's a great point. According to this Reb Moshe, he says if you could think however much you want to think, but if it's not healing you, it's not a problem. Yeah, but it doesn't matter because it's not healing you. That would be an interesting application of this Reb Moshe. Yeah, I would imagine that would be mutter. But the other the other pills are maybe problematic. But you don't know which ones they are. I don't know. I would have to think about if you should be involved in a trial like that. But just if you want to take just a snippet and a theoretical, according to this Reb Moshe, it would be potentially okay. Let's try to maybe suggest that there is another heter. I mentioned this earlier, but we mentioned that if a person is a chola, then we can take medication. So would we consider, again, it's an open question, how much of an impact does a person's ADHD, how debilitating is it? Would we consider the person to be a chola? Another possible heter, I think I'm up to number 5, is l'tzorech mitzvah. Rabbi Reuben in his tshuva, which again I said I don't have access to, but he suggests maybe a person needs to focus during davening. They want to learn, they want to be able to do mitzvos, and they can't have a proper davening on Shabbos if they don't take their Ritalin medication. Now, maybe it sounds a little bit radical to you, but it actually is fairly on the books. The Radvaz, in source number 19, Chelik Gimel Simin Tov Reish Mem, points out, I'll just tell you basically outside for time purposes, he points out that we have certain leniencies when it comes to Amir L'Nachri. When you ask a non-Jew to do a malacha for you, in a mutter context, it has to be something called a shvus b'makom mitzvah. If it's a double derabanan, it's 2 rabbinic prohibitions, and it's a context of a mitzvah, you're allowed to do it. And he proves, for a number of different reasons, that we're more lenient when it comes to refuah than we are when it comes to Amir L'Nachri. So, if we are more lenient by a chola, for example, we don't require the chola to do a shinoi. We don't ask the chola, okay, put it in your mouth like under that tooth or whatever, or maybe stick it under your yarmulke first and whatever. No, we don't tell you to do any of that. We tell you could take the medicine regularly. Why not? Because it's more lenient. So if that's the case, then maybe we could say if we're lenient by a case of a shvus b'makom mitzvah when it comes to a non-Jew. In a case, let's say, of a mitzvah, we're going to allow you to ask the non-Jew to put out a light, for example, of a child who, or what's a good example? Any makom mitzvah, maybe we could be lenient for the purposes of taking medications if we could prove to you that we'd be lenient in such a case for asking a non-Jew. That is, in fact, this Radbaz is utilized halacha l'maisa by the Minchas Yitzchak in source number 20. He writes that he was asked this following question about some sort of medication that a person would take with it, some sort of heart condition. Before, let's say they would, before having a marital intimacy, they would be taking this medication before and after because they had a heart condition, and he wants to know, can he take it on Shabbos? And he writes, yes, you can take this medication on Shabbos. And what's his answer? Because he proves that it's a dvar mitzvah, he's involved in a mitzvah, and because we are lenient when it comes to Amir L'Nachri, as we saw, the Radbaz pointed out that refuah is more lenient than asking a non-Jew to do the malacha for you, and therefore, if you could prove to me that we'd be lenient when it comes to a non-Jew, then you could do the refuah on Shabbos. What about another heter? Another possible heter, interesting. I won't go into all the details of it now, but the Marach Ur Zarua in Simin Nun Vav and Nun Zayin. This is from, I believe, Marach Ur Zarua is I don't know if it's the end of the Rishonim, but it's much earlier. And he writes that Chazan will be allowed to chew some sort of something in their mouth, some sort of spice to freshen their breath. And he says, because of kavod habrios, people have bad breath, and therefore it would be okay to chew that on Shabbos. He also mentions that, let's say they want to clear up their throat. Some chazana, maybe they have some liquid, some sort of sucking candy. He says they're allowed to do that. He says that they should do it b'tzina because it helps their throat, but maybe people shouldn't know about it. But he says they should do it let's say to open up their throat. If they're a chazan, they could be very hard to listen to if they're very croaky. So they're allowed to go ahead and take this mishum kavod habrios. Another heter for Ritalin. So just to bring it full circle, a person is not going to have anyone to talk to. Everyone's going to think the person's off the wall. If they're in yeshiva and they have certain, social events, or the child, if they're not on the medication, will be impacted, and their own dignity could be impacted by them not taking their medication. In general, children are more lenient. And the Ramah says in source number 24, Simin Shin Chav Chesiv Yud Gimel, that a child is considered like a chola she'ein bo sakana. How old do we consider this to be? Is a whole discussion. The Minchas Yitzchak says for purposes of food, we could even be up to the age of 9. Even for other things, it's a little bit different. It's hard to know exactly. The general principle is that for the purposes of what the child needs, that's how, just summarizing for time's sake, that maybe if the need is such, as I mentioned, for food, then they could be even older. But maybe for the child with ADHD, maybe their need for this medication is of a higher necessity, and therefore maybe could even extend to an older age. Heter number 8 is mixing the medications into a food before Shabbos, which is the Gemara in Shabbos Kuf Chesam Beis says that Mar Ukva, he said in the name of Shmuel that they were able to soak this kilorin in Erev Shabbos, some sort of thing that they put on their eyes, and they would put it on their eyes, and they would put it on Shabbos. And why would they be allowed to do that? Because Rashi says that there was some sort of hecker. They went through some sort of distinguishing act or reminder that they were doing something different when they did something before Shabbos to use it on Shabbos. So perhaps that would be, if you need to take the Ritalin, I don't know if it's still effective, but if you put it into some applesauce, maybe 3 minutes before Shabbos, and then you crushed it in there. This is not to avoid the problem of crushing. This is just to make sure that you're doing some activity to delineate or to make it clear as a hecker that I know that I'm doing something to, permit this. It shows that I know that it's not generally permitted, but I'm doing something differently that you're maybe allowed to do. And Rosh Zalman Shmir Shabbos Kochasa says you're allowed to do that, to crush it in before Shabbos. At the end of the day, Lamaisa, Halacha Lamaisa, Rabbi Reuben is lenient when it comes to taking Ritalin. I asked Rabbi Shiner as well. He said we're lenient. He gave a few reasons. Number one, we're makel on this is a term that I just prophylactic medication, meaning you're allowed to take something preventative medication. You're preventing things from happening that we're lenient on. So in Ritalin in general, you're preventing certain symptoms from happening. I'm not advocating yes or no for Ritalin. I'm just using it as an example. And then number two, he said that we don't look at it as a choli. We don't look at it as a sickness. Maybe the Lesher's paradigm of it has symptomology, it has, but it's not an illness. And so you could look at it in two extremes. You could say it's an illness, and therefore it's allowed because the person's a chola. Or you could say, no, it's not an illness at all, and that's why it's allowed, because we don't look at it as treating an illness. Maybe we'd make it more akin to birth control or hormonal treatment. It's not treating an illness. It's dealing with a certain symptom. So because of all the different reasons that we mentioned, it seems to be, I didn't ask that many people what they're, what people do. It's none of my business, but in general, it seems to be that Ritalin is a good example of a medication that would be able to be used on Shabbos. And we covered a number of different topics. I know that I kind of just threw them all out there, but it seems to be that just as a practical matter, to have a bottom line, that you would be allowed to take the Ritalin on Shabbos. I didn't get a chance to ask Rabbi Karapkin, but I think that seems to be pretty clear. And regarding our first question, it seems to be that the mainstream opinion is to consider the prohibition of refuah generally to be in place, and then try to find leniencies as we mentioned, many of the different leniencies that are accepted by the poskim. Okay, we'll hold it here, and happy to welcome any other further questions if you want. And if you need to get to Marv, there's a 9 o'clock Marv.